Hey, Dr. Thornton here with another quick video on showing you how to do trigger point therapy or massage therapy with a ball at the house. All it requires is a ball such as a baseball, a golf ball, tennis ball, racquetball, super ball. You're going to vary the type of ball that you use according to how firm you want it or how large and diffuse of the contact area that you want, depending on how sore you are. The baseball is going to give them more firm contacts, so if you're not too sore and you want a more deeper, firmer massage, you're going to use the baseball. If you want something a little more soft, you're going to use a tennis ball, racquetball, or super ball because it's got a little more give into it. And basically you're going to take the ball and you're going to pin the ball between your body and the wall and use your body force as the force or contact force that's going to push this ball into you in the areas that you're massaging, such as between the shoulders, the low back, the hip, etc.
Okay, you can see that I'm simply placing the ball between my shoulders, and I'm going to use my body to pin the ball against the door. Keep in mind that a textured surface is better than a slick door surface, because you'll observe in this video the ball will kind of scoot around a little bit. Also, if you notice you're having a difficulty keeping the ball from falling, just drop it in a sock, a long sock, or a leg of a pantyhose, and that way you can just flip it over your shoulder and pull it up to the level that you want massaged. Also, you might find it useful if you move your arm or body part in different positions to reorientate the muscles.
I hope you found this video informative and realize that you are empowered to do things after hours or on the weekend. You don't have to sit around and just take the pain. There's very simple to do these type of exercises. Again, I demonstrated in the upper back, but pretty much any area where there's sore, the muscles are sore, and there hasn't been any contraindication of motion told to you by your provider. There's no reason not to move or push on the area like open wounds, lesions, stitches, or something like that, and you're basically able to just massage it out. Do it for a couple minutes at a time only, move to a different area, and when you're followed, it's a good idea, at least in the beginning until you know how your body's going to respond, to go ahead and follow with 15 minutes of an ice pack application. This will prevent a excessive inflammatory response if you go in and actually provoke a little bit excessively the sore tissue. This is the same thing that professional athletes do. 20-year-old baseball pitcher in the prime of his life throws 60, 70 pitches, gets pulled from the mound, they put in a new pitcher, and the trainer comes over. They don't ask him if he's any pain or anything like that. They know he's done repetitive throws. They just ice his arm. So the same thing when you're doing therapy at home and in any of the videos that you watch of mine, you're going to want to make sure that you follow up any type of provocative activity, especially in the beginning when you don't know how you're going to respond, with an ice pack, a 15-minute application of ice. If you're using ice in a Ziploc bag, make sure you use adequate layers of cloth between you and the skin so you don't burn yourself. And with a gel pack, you're just going to have it adequately covered in order to give you comfort, so you don't just place a super cold gel pack against your skin. And other than that, you're empowered and free to do this any time of the day or night, weekends when the offices are closed, you can't get into your provider, and basically anytime you have minor aches and soreness that you can work out, where just a nice massage would be beneficial. Another side note, the alternative is you can do it as long as you want, whereas if you get a spouse or child, significant other, somebody else to try to massage you, it's probably the same as when I give. When I give, I can give a 15, 20, 30-minute massage, and it always seems when it's my turn, the person does it for 5 seconds before they ask me, is that good enough? So it allows you just to basically use your own body force. You're able to control the amount of pressure that's put on the sore areas. You're able to do it as often as you want, as frequently as you want, other than just don't do it too excessively any one given time, and make sure you follow up with ice. I hope you've enjoyed this video. I'll see you in the next one.